Morning, everybody. My name is Tony Vickers-Byrne. I'm recently retired as the Chief Advisor for HR Practice at CIPD and spent about over 30 years, 35 years in the NHS and civil service, and many of them as a HR director. And latterly, I think, really concentrating on the importance of being kind to each other, and something perhaps that HR hasn't been very good at in the past, hasn't been expected to be good at, and hopefully the next few minutes just convince you, if you need to, about the real importance of it. I think looking back over the last 18 months, I think the real standout event was in Liverpool. Remember, it was the 31st of March 2019, freezing cold Saturday morning, and we had over 200 young people who were mainly at the beginning of their HR career come together to actually network and to have presentations from people like myself. In the presentation, I asked at the start, how would they like to be described? What's the thing that they would most like to be known as in their organizations? And I remember when I talked about this afterwards, there was a few raised eyebrows from people of my generation when I said that those young people were talking about wanting to be known as being kind and caring and compassionate and wanting to make organizations happy places for people to work. And just thinking back to, my background and how things have changed in HR. And over the course of the last 6 weeks, they've changed more than at any other time. And I'm an addict to Radio 5 Live, normally for the sports, but there's not a lot of that. But what I do every day is take my radio down to the garden and listen to people like Emma Barner and to Nihal Arthanaika, who runs an afternoon show. Nihal used to be a DJ, and now he runs a really great phone-in show on Radio 5. He had Amanda Holden being interviewed a couple of days ago, and Amanda was telling her story about when she gave birth to a sleeping child, and she then went into a coma after the birth, and seriously ill. And she was talking about when she came out of the coma, and the thing which she really remembered. And her parents were due to come and see her, and she felt, her hair was all over the place. She didn't feel good. She wanted to look as good for them as possible to reduce their worries. And she mentioned this to one of the nurses on the ward, and the nurse came over and stroked her hair and put it back into place. And it's the thing that Amanda said that she remembers most about the care when she was in that hospital, about going back to when she was a little girl and her mother stroked her hair and made sure that everything was okay. It was a really lovely thing. And it reminded me of a guy I used to work with, Dr. Aidan Halligan from Dublin. And Aidan, I only worked with briefly, unfortunately, at Public Health England, when he was leading on our Well North initiative. And this was using people from local communities who were disadvantaged to be real role models for the well-being of their staff. And it was based in the Northwest. I'm from Manchester. It was really dear to me. And Aidan was this wonderful, pioneering, passionate doctor who was a role model for so many people. And the thing which I remembered about Aidan more than anything else was a lecture that he was giving. He wouldn't have called it a lecture, he'd have called it a talk he was having with a number of junior doctors, again at the start of their careers. And he was talking about what it meant to be a doctor and the privilege that that gave people. And he was talking about authority not coming with rank, not coming with title, not coming with money. He said that authority comes with caring. And he told a story about an 1891 painting called The Doctor. I think it was the first painting to ever sell 1,000 prints in the US, because it went straight to people's hearts. It's a picture of a doctor sat beside a dying child, with the parents close by, and the doctor not being able to save the child from meningitis, but being there all night, And the values and professional values that that doctor showed were truly, truly at the heart of what people want. And he reminded those junior doctors never to forget that they would have the privilege, perhaps on a regular basis, to be with somebody who was dying, and perhaps to be the only person there when that person was dying. And when we think what's been happening over the last 6 weeks about our medical staff and our nursing staff having to be there, holding people's hands when they die, and the outpouring of support that those simple, compassionate, kind, caring actions take, it shows just how vital this is for us as human beings. So I've been spending the last 18 months talking to HR people about kindness, learning from them, and just feeding back that the most important role for HR function in these days and going forward is to make organizations kind, to support managers to become truly compassionate and caring line managers, to put the welfare of their teams absolutely at the forefront of their responsibilities.